March is National Social Worker Month, and joining us now is a CoResponder clinician who partners with the Bloomfield Township, Auburn Hills, and Birmingham Police Departments in order to help citizens who come in contact with their local law enforcement. Hillary Nusbaum from Dr. Kendall and Associates joins us now on the Michigan MegaCast. Thank you for being with us, Hillary.
Thank you.
Great
to be here.
Yeah, appreciate your time. So you're a CoResponder clinician and you're also a therapist at Dr. Kendall and Associates. Can you tell us about your background and what led you to wanting to go into this line of work, be a therapist, and help people in our local community?
So I have a background as far as professionally in school social work. So I've been a school social worker for 11 years prior to this job. My stepfather was the public safety director out in Coldwater, Michigan. And he really inspired me watching him do his job. And I have, a knowledge that both military and law enforcement, first responders, really lack having any kind of, trauma training or background, with when it comes to encountering mental health. So one of the things I've always wanted to do is work with law enforcement or first responders in some way, shape, or form in my career. And so when this opportunity presented itself through Oakland Community Health Network, I threw my name in the hat and said, this is something I want to go for.
And so let's elaborate on that. You mentioned military and law enforcement and some of their issues with interacting with people that may have mental health concerns or may have mental health factors that are impacting their behavior. We've heard so much about reform of law enforcement or greater training for law enforcement over the last couple of years. From your perspective, having worked with law enforcement but also worked in mental health capacity and as a social worker, what are some of those lacking areas that you help police departments and that you help others sort of bridge those gaps in considering mental health and considering trauma in their approach to law enforcement?
Yeah, I think pairing a social worker with police specifically, I can speak about my job. Police don't necessarily have the training and background in, mental health disorders, certain types of like psychotropic medications that get used for disorders, trauma training, crisis de-escalation techniques. Those are all skills that certain social workers have, and a lot of mental health clinicians are very aware of. So those are things that we can bring to the table to help out with police and pair with them. I know that we are working really hard to help police get trained in some sort of mental health initiatives. So we have a crisis intervention training, CIT, that puts police through 40 hours of mental health training, which is wonderful because it just introduces them to certain skills that they can use while they're on the job. And that's one thing that I know that Oakland County is really serious about, trying to get some of these departments trained in that.
And so let's talk about the way that this sort of training can be effective or more effective than traditional protocols in law enforcement for approaching law enforcement situations, especially more tense situations with potential criminals or just people out in the community that may be causing a disturbance in any sort of moment. When you have that trauma training, that mental health training, and you're approaching that situation as an officer, from what you're training these officers and the CIT training that they're undergoing, how is that approach different from what they are traditionally utilizing as their approach to these sort of situations?
I think traditionally police tend to have let's get to the call, let's problem solve as quickly as we can and make sure that, we get that person wherever they need to go and we move to the next call. Police have a lot of calls that come in. And so they are constantly going from one call to the next. So I think, historically police are trying to get through things as quickly and effectively as they can. However, they haven't had the mental health resources. So part of CIT training is slowing down, especially when you're on a mental health call, really working on verbally de-escalating a situation, thinking about what the best approach is for how to handle a situation. Is the hospital the best place to take someone, or should we be looking at, like common ground services or Does that person already have therapy? And maybe we just need to contact a clinician. So it's really just slowing down that problem solving a little bit. And together, like me, along with police, really thinking about like, what is the best course of action here? And even though it might take more time than a typical call, it's making sure that we're getting that person the best resources in the most effective way we can.
And so how effective are these methods in de-escalating these sorts of situations that may be quite tense or even dangerous for the person involved as well as law enforcement and those in the surrounding areas? How effective are these methods in de-escalating those situations, and then on top of that, helping these individuals that may need greater assistance from their community to prevent them from returning to a similar situation in the future?
Yeah, so that's a great question. We're actually collecting quite a bit of data on that right now. One of the big outcome measures that we're looking at is use of force. If we can lessen the use of force techniques used by police, then it's already positive. It's already being effective. And we are seeing that there's less use of force on certain scenes, less arrests and more jail diversion, meaning trying to get people mental health help and resources if that's what they need. We are working really hard on making sure that people have access to, like, Oakland Community Health Network gives access to many different providers. So we have a lot of data showing that people are getting connected to those providers and actually getting those resources that they need, rather than police showing up and maybe just taking them to the hospital, or sometimes they're just left under the care of themselves or another person. And that has been the traditional way of doing things. So the data that we have currently is backing up, that having a mental health clinician is effective.
And what has been the response from those in law enforcement that you are assisting with this training, or that you are assisting in the response to these different calls that they're going on? What's their response to what they've been experiencing in this different paradigm, and how it's allowed them to do their job effectively?
I've had a very positive response. I've been pleasantly surprised, knowing that the police have such a family oriented, nature among each other, that to enter as an outsider is difficult. And so, I've been really welcomed quite warmly and have had a great response. I get called to scenes a couple times a day when I'm working, and I get a lot of referrals from police to follow up with individuals. And I'm beginning to form those relationships with officers, with detectives, with police staff, just to begin really working more efficiently together. So it's been a really great experience so far.
We're joined by Hillary Nusbaum, co-responder clinician and therapist at Dr. Kendall and Associates, joining us on the Michigan Megacast. More information from Dr. Kendall and Associates on their website, drkendallassociates.com. Kendall with one L at the end, drkendallassociates.com. And so, has the COVID-19 pandemic how has the COVID-19 pandemic had an impact on the necessity for greater mental health services in our community? And then with that response, how has that impacted not just local police, but also public safety and the community approach to mental health in general?
Well, I think COVID-19 has had a major impact on mental health. I think it's raised anxiety across the board. When I worked for the schools, we've seen a major impact with kids having higher anxiety. Families being at home together and working from home creates more, family trouble type situations coming up. There's more, when you have more people packed into a house, it can create more problems along the way. So certainly the anxiety has raised. I think there's been economic issues. People have lost jobs. There's been quite a bit of disturbance from COVID-19 for obvious reasons, but that also increases stress for families and individuals. And that's more calls to 911 and more calls to police to come to their home to help out. So police are definitely seeing it, I think, across the board, and seeing the rise in mental health cases and need. And I think that's why they're very happy to have a mental health clinician come along and try to help take some of that load.
And so, Hillary, take us to the scene of these calls when you and when officers or other law enforcement officials are responding to these calls. You get on site, you have some information maybe about the person or the people that are involved in the disturbance that's being called in, but you may not have the full story to really be able to approach this person with the care that's necessary, but also the caution that's necessary for them, for the officers, and the greater community. So where does that approach start in this particular methodology when you get on site to these calls?
Yeah, so kind of from point A through Z, I carry a prep radio just like a police officer. So they're able to let me know if a scene is safe for me to approach or not. If it's not, then I wait for them to essentially make sure that the scene is safe. When I approach, usually an officer will greet me and kind of give me a quick rundown of the situation, and then let me know how I can be most useful. And so when I enter that scene, and try to talk to that individual, I might help de-escalate a situation. I may be working with the officers and trying to problem solve, like, what's the most effective path for this person moving forward? Are we looking at common ground? Are we just able to de-escalate and leave that individual here with resources? Or like, what's the most effective way, kind of moving forward? So together we kind of problem solve and make a plan, and then go from there. So walking into a scene, usually I have a little bit of information from dispatch, and then that officer will greet me and sort of tell me what's going on. And it's gone pretty smoothly for the most part. I mean, we are both learning each other. I'm learning the police world. Police are learning, how I can be useful on a scene. So we're learning that together.
We're joined by Hillary Nusbaum from Dr. Kendall and Associates, joining us on the MegaCast, a co-responder clinician and also a therapist with Dr. Kendall and Associates. I want to give you a few minutes to talk about the work that is done at Dr. Kendall and Associates and some of the services that people in our community, as well as organizations in our community, can utilize through this company.
Sure. So I have a private practice with Dr. Kendall and Associates, and they specialize with anxiety, trauma. They work with children ages 0 through 18. They have a nurse practitioner on board that can help with medication purposes. So it's really a come one, come all type service. We really try to reach as many different cohorts of people as we can. I think it's also important to say that I am an employee of Oakland Community Health Network, which has allowed me to do this job with police and work with them. And so they've really opened up this position, and are really working with Oakland County Police to allow more clinicians to be involved. So they have providers like Easter Seals, community, a lot of community providers and those kinds of things that can help with services for individuals.
So lastly, before we let you go, if our viewers are having mental health issues themselves, they're noticing their mental health slipping, or they're having some issues maintaining their mental health, or they know someone in their life that is, what are those first steps that they should be taking to get help from someone like yourself or other professionals at Dr. Kendall and Associates and other organizations locally and across Michigan if they are in need of help?
I mean, certainly what I would do is start with whatever insurance that individual has. And there should be a number on the back, and they can call and see what providers actually will work with them, so they don't hit a lot of barriers in trying to receive services. If you don't have insurance, you can contact Easter Seals, and they can try to help you get services, that way. I would say Oakland County has an access program, and they are kind of the front door to getting services for anybody in Oakland County who needs it. So I would contact Access. You can just Google that, and they work with Oakland Community Health Network.
We appreciate your time. Thank you so much for joining us, Hillary.
Thank you.